Good afternoon, everyone, and thanks for joining us today at our Food for Thought seminar. Before I introduce you to our speaker, I'd like to remind you of some housekeeping rules. Since we're on Teams Live, you'll not be able to unmute your microphones to ask questions. You will, however, be able to post any questions in the Q&A chat box to the right of the screen. We welcome questions throughout the presentation. However, we will not cover these until the end of the talk. Finally, please note that today's seminar is being recorded. Lisa is a chartered environmental health practitioner who has worked in central government academia for over 30 years and is an independent consultant providing advice and support to the food industry sectors and mass media on food safety issues for businesses and consumer hygiene. Lisa worked for many years as Food Safety Advisor for UK Hospitality when she represented the organisation at the Food Standards Agency Expert Advisory Group on regulating our future industry liaison groups, FSA-led workshops, and also on the Safe and Local Supplier Approval Board. She provided media advice and comment during the peak of the COVID-19 pandemic, and with Sterling Crew, her business partner in Kitchen Conversation, created and attended the CIEH Covid Conversations Panel, often joined by over 1,000 delegates virtually. She joined Reckitt in 2021, where she works on internal and external scientific engagement across the company, including working on B2B projects and hygiene partnerships, such as COP26 and the Commonwealth Games. She has recently given evidence at the Cleaning Industry All-Party Parliamentary Group on how targeted hygiene framework can be used to build health resilience. I'll pass you over to Lisa now.
Thank you very much for the invitation to come and speak to you, and also thank you for the introduction, Angela. So today I'm going to be talking about targeted hygiene and what it is, how we can break the chain of infection, because to my mind that's what public health is all about. How can we actually stop people from being ill? And that is in particular in relation to infectious diseases. That's where my interest lies. In addition, at the end, or towards the end, I'm going to start just discuss a little bit about quantitative microbial risk assessment, which is something that we have become involved with more recently. So my background, as you heard, is I'm a chartered environmental health practitioner. I'm also the industry trustee for the International Scientific Forum on Home Hygiene. This is an incredibly useful organisation for anybody who wants to find out information about hygiene in the home. And it's a charity, and the chair is Sally Bloomfield, who is a very well-established author of many publications, particularly on targeted hygiene. So in another capacity, I'm also the chair of the Food Special Interest Group for the Royal Society for Public Health. Now, a lot of people, when you say you work for Reckitt, have got no idea what you're talking about. And then when you start talking about the types of products that Reckitt make, you can just see there on the screen the breadth of things that Reckitt are involved with in relation to hygiene, health and nutrition. There are 43,000 employees, which has taken me a while to get to know some of them, and a huge net revenue. So the typical things in terms of hygiene, which we are all familiar with, are things such as in America, Lysol and many other countries around the world. This is a global organisation, and also Dettol, but they make a lot of products such as Durex, for example, Nurofen and Strepsils. They've got many different departments and many medical directors who lead those departments. So I'm in the germ protection department, where it covers hygiene and health. So the background for Dettol is really going back to 1933, and I was just telling Angela about how I saw the very first bottle of Dettol the other day in the museum. So there's quite a long heritage with that, and with the Lysol version of Dettol, which started in 1889, was used to help with cholera epidemic in Germany. So it does go back an awful long way. So over to the issue in hand then. Got a few fact or fictions here just to sort of really get people thinking. And if you talk to someone from the Daily Mail, then they think that all germs are harmful. But of course, in fact, that's fiction, and I'm sure you all know that. However, what we want to do really is to make sure that we actually do something about the small numbers of pathogens that cause infections and how we can control those. So traditionally, in relation to hygiene, you can probably remember the Domestos advert about killing all germs dead. But really what we're trying to do is to focus on the pathogenic organisms that cause respiratory, gastrointestinal or skin infections. And I think it's important to remember that pathogens only cause harm if they actually get into the body. And we're very conscious that we don't want and can't have a sterile world. Just play this video, which just sort of explains
it. Harmful germs make us ill. They may be all around us, but they only make us ill if they get into our bodies. The journey of the germ or chain of infection describes how germs are moved from where they are found and how they get into our bodies through the nose, eyes, mouth or skin. So let's take a closer look at this and then critically find out how we can break that chain of infection. If someone has an infection, germs can leave their body even if they don't show any symptoms. This happens from sneezing and coughing or simply breathing or talking. Germs can also get out of the body from skin wounds, from blood and excretions such as feces and urine. Germs can either invade the body directly, for example, if someone coughs or sneezes in your face, or indirectly, from microbes getting onto frequently touched surfaces, such as door handles, toilet flush handles, taps, or food preparation areas, and then transferring via hands and to the eyes, nose, or mouth. In the case of food poisoning germs, they can get onto foods that are eaten without cooking, such as sandwiches.
So in relation to trying to break the chain of infection, many of you might have seen something called the Swiss cheese model, and this really tries to explain all the various things that could be put in the way to stop the chain of infection, to break it. So on the left-hand side, we've got the microorganisms, and this is particularly, it was developed in relation to COVID-19. And there are lots of interventions that we can make to make it more difficult for the germs to pass through the holes to get to the other side where they infect people. And one of the interesting things is that, of course, when we started to remove some of those layers, then that meant that people could be more vulnerable to infection. So I think it's always good to think about prevention of infection as a number of measures that together can help to protect people, and it's not necessarily just one thing. So hygiene, which is the thing that really drives most of the work that I'm involved with, we see as the foundation of health, and it's a term applied to practices aimed at promoting good health by breaking the chain of infection. One of the things that I've noticed over the time when during COVID was that some of the hygiene advice wasn't necessarily all that helpful. And this caused me quite a lot of concern, and I spent a lot of time on the radio, on the television, talking to people about when they should wash their hands, not simply that they should do it frequently. And this is all part of a fundamental belief that I have and Sally Bloomfield has, that what we need to do is actually target the interventions that we have, not just tell people to blindly wash their hands, because in the early part of the pandemic, people were washing their hands so much that they were actually making the skin raw. And I know people's children were coming home from school with really very, very sore hands because the teachers were making them wash their hands too much. And often it seems odd for someone who works for an organisation that makes the likes of Dettol to say don't use products as much, or don't wash your hands as much, but wash them when they really need to be washed, because you think, well, that's reducing the amount of products that's being used. but that's really not what I'm all about. I'm trying to make sure that people use things and take the interventions at the right times so they make the maximum effect. So the IFH carried out some online polls with the RSPH, and what we found was that there was a barrier to change from the public's poor understanding of hygiene and also how it differs from cleanliness. So when you talk about cleanliness with someone, and hygiene, they don't necessarily know the difference, and we'll come to that in a little while. The online poll that we did in 2022, and this was the IFH and the RSPH together, found that people were keen to practice good hygiene in the home, and they intended to make more effort to practice good hygiene and continue to do so. So, you know, in the 70s, this is good, this is encouraging. And they thought that it was as important to change behaviour to prevent the spread of infectious diseases as it was to prevent climate change. But then have a think about this. Can we contract COVID through your skin? I'm sure everyone on this call will know that that's fiction. But in the poll, we actually found that 31% of people thought that they could be infected by virus penetrating through the skin of their hands, and 59% said wearing gloves was important to prevent the spread of COVID-19. Now, those two things are really interesting, because if you think about it, people were being told to wash their hands frequently. And it may be that they didn't actually know what the route of infection was. So they may have thought that, you know, it was going to come through their hands, the skin in their hands, and that's why they needed to wash them. And also thinking that they should wear gloves was interesting, because of course you've probably seen people going around wearing gloves, and I've certainly over the years inspecting food businesses seen people wearing gloves and thinking that somehow they're protecting the food by wearing gloves or protecting themselves, whereas in fact if you don't change your gloves at the right moments, or if, for example, in relation to COVID, you put your gloves in your eyes, then you are going to be transmitting COVID in just the same way as you might be if you've got dirty hands. The other thing was that there was this sort of rush to clean the house if someone's got COVID, and this wasn't just the house, this was also in many public spaces. So particularly in the early days, if someone in a pub had COVID, the whole pub closed down, and someone went in there and sprayed everywhere to get rid of the virus. And, you know, this really was now, we think, pretty over the top. And in some ways, this sort of manic cleaning may actually miss the very things that do need to be disinfected. And much of it was probably unnecessary. And the other fact or fiction thought is, if a surface looks clean, it's hygienic. And again, that is fiction, because I've carried out many studies over the years where I've swabbed surfaces in homes all around the world, and also done a visual assessment at the same time as doing the swabbing. And it's incredible, really. Something that looks absolutely spotless can be extremely unhygienic in terms of even containing pathogens that we picked up in some countries on surfaces that were going to be used for food preparation, for example. And also surfaces that may look really dirty because perhaps they've got lots of tea stains all over them, were actually pretty free of pathogens. So one of the things that we do sometimes in trying to get people to visualize germs is to use the glow germ powder, and this is something that just glows in ultraviolet light. So you can put it onto surfaces and demonstrate that journey of the germ. How does the germ move around? And getting people to understand the routes of infection and the journey of the germ is something that is sort of my day-to-day task. I feel very strongly that if people understand how germs move around, how they can cause infection, and critically how they can break the chain of infection, then we can help people to protect themselves. So just as a simple one, for example, such as saying to people, do not, if you've got dirty hands, unless you know your hands are clean, do not put them in your eyes. Particularly if you're in a public place where you may have picked up respiratory viruses. That simple tip doesn't really involve anything other than a behaviour change. It doesn't involve any disinfectant, hand washing, anything like that. It's just, if you've got dirty hands, keep them out of your eyes, nose and mouth. And you know, that could save a few people from getting sick. So let's just think about hazard and risk. And this is often something that causes a little bit of trouble with people. And this can be why we end up getting a bit overzealous in terms of cleaning and disinfection and hand washing and so on. So a hazard then is something that has the potential to harm you, and the risk is the likelihood of it causing harm. So in relation to pathogens, it's really, are you exposed to that hazard, and what's the likelihood of the pathogens causing harm when you are exposed? So they're only going to cause harm if they get into the body. So it's a bit like with sharks, really. They can be swimming around in the sea and they're a hazard, but the likelihood of them causing harm is only going to occur if someone actually goes swimming with them. So how can we reduce the risk? So if we think about the sharks, we could inform people. So tell the swimmer about the hazard. Tell the swimmer about the risk of being eaten when in shark-infested waters, and tell them to stay out of the water. The opportunity there is you could put a shark net in place, or have a swimming pool instead of the sea if you want to go swimming. And the motivation for that is the swimmer doesn't want to get eaten. So we think about the microorganisms, the pathogens, then we can educate people about hazards and risks and how this could affect a household. We can explain how to reduce risks. And I would add as well that we might want to start explaining as well about the sort of cost benefit. So you can see this here is a behaviour change model really called CONB, but I'd like to combine it with some other behaviour change models which also look at other things, such as educating people about their susceptibility to illness, the severity of the illness, giving people that information, and explaining the routes of infection, and why they need to wash their hands and when they need to wash their hands, for example. The opportunity is providing good quality, easy to use products so that it makes hygiene simple, and that might not need to be a product, it may be just a process. And then we've got the motivation is to keep people safe, and also the benefits outweigh the costs. So if we're trying to talk to business, we might have to say things like, well, if you can keep your workforce at work and not sick, this could save X amount of pounds per year, because you're not losing staff because they've got respiratory illnesses, for example. And also we need to know and remember that vulnerable people need more help, and we need to look after those too. So that might mean that the hygiene cranks up in those situations. So we've got breaking the chain of infection really is making sure that the microorganisms don't get onto the hands, for example, as one of those routes in the Swiss cheese model. It's not the only one, of course. We've got protection against people coughing and spluttering and so on, and elimination really as well for people who have a cold or they have COVID, keep them out of the way of other people. Now, in terms of hygiene, there are quite a lot of threats to hygiene. One of them is the hygiene hypothesis, which I'll go into in a minute. And there's also been quite a lot of backlash because of the hygiene theatre. So people going around spraying and everyone going, oh, fed up with that, fed up with COVID, hygiene fatigue, I cannot be bothered anymore, I'm not going to wash my hands ever again. There are also concerns about chemical overuse and whether chemicals could themselves be dangerous. Sustainability issues in relation to chemicals and use of water for washing hands even, and destruction of the microbiome. Now, the interesting thing is the microbiome and the depletion of the microbiome, and this is linked to the hygiene hypothesis, is really because the depletion may be for many things, but probably not from cleaning. So there's a really good publication here with the RSPH that's about 2018, Too Clean or Not Too Clean. And it was really the case for targeted hygiene in the home and everyday life, and why cleaning at the right place and the right time was really important, rather than saying we don't need to be clean at all. So things that have been associated with the depletion of the microbiome, particularly in the gut, are things such as cesarean births, babies not being breastfed, use of antibiotics, not going outside, and meeting what Graham Rook, who's a big author in this field, calls the old friends. These are the microorganisms that we might not have in our body anymore because we don't go out much and we don't do the foraging that we used to do years and years ago. Fewer siblings, an urban environment, and a beige diet, or in other words, a processed diet, people not eating fresh foods. So despite all of these concerns about hygiene, we still have a large number of gastrointestinal infections a year, and respiratory infections are rife. So we can't really say that we're too clean because we are still getting infections. And the hygiene hypothesis, it just rolls off the tongue so nicely. And this was a paper in 1989 that blamed rising allergic diseases to be caused because of lack of infection in early childhood, and basically came to the conclusion that we're too clean for our own good, and that the high standard of personal cleanliness was causing people to have allergies. And that has been debunked, but it still gets raked up by the newspapers because it sounds quite exciting. And you know, it's quite convincing. But the consequences, of course, mean that people may not be clean enough for their own good. And there's sort of so many myths that come from that we're too clean. That's the cause of cancer. We need a bit of dirt to boost our immune system. Why bother with cleaning? And it's these beliefs that can be barriers to change of behaviour. And then we have the responses from the media, which is, you know, there's quite a lot here from the Daily Mail. But, you know, it's if you're a clean freak, it increases your risk of illness. You mustn't keep children too clean. I remember once reading, I think it was in the Mail, a comment by Dr. Miriam Stoppard that you should take your children to a farm, let them get really dirty and don't wash their hands and give them food. And, you know, you're just thinking this is so dangerous, because, of course, we don't know when we have dirty hands whether we've got pathogens that could basically kill us in relation to something like E. coli 0157. And how someone who's a medic could say that was a good idea, I really don't know. So, again, more reasons not to clean. And then we've got sort of on the other side, we've got the media always were asking me, you know, what are the worst things, what are the germiest things in your home, what are the hot spots, and so on and so on. And actually it's really the chain of infection isn't so much we're telling the journalists this till we're blue in the face, but you know, it's not to do with the hotspots. It's more to do with the way that the germs move from one place to another. So you can have masses of germs in a plug hole. It might not matter at all. But if you've got some E. coli 157 on a kitchen work surface from preparing mince beef, for example, then that's much more worrying, because you could be transferring it into other areas of the kitchen and directly into your mouth if you bite your nails, or you perhaps take a drink or eat while you're working in the kitchen. So we've got this sort of dichotomy. We've got we want to protect against infections, and people are worried about destroying the microbiome. And then we've got scenes like this where people are going around spraying everything, using a lot of chemicals, they're all in hazard suits, so it doesn't look as if the chemicals are very friendly to health either. What's the relationship between what's going on there and health? Well, that may not be good at all either. But then on the other hand, we do need to try to reduce the risks of infection in a more controlled and balanced way. And one of the great things about reducing the risk of infection is that that has a knock-on effect, that perhaps we can then reduce the number of antibiotics needed to treat infections. So targeted hygiene then is about breaking the chain of infection at the right place, in the right time, in the right way. And we're not creating a sterile environment. We're not overusing chemicals, so it's sustainable. We're reducing the risks of infection, meaning fewer antibiotics are used, and it's a risk-based approach. So we're then balancing this protection of infections, and we're still protecting the microbiome because we're not annihilating everything. We're not attempting to use too many chemicals or too much of any particular intervention to destroy other organisms which may be helpful to us. So what we have done at the IFH is produced a document about the 9 moments of hygiene. And we've identified through research into many published papers the sorts of areas where we need to take action. And so we call these the key moments or actions when hygiene really matters. So that might be when caring for pets, like mopping up accidents and de-pooing the garden. It could be after handling or preparing raw food, using the toilet, clearing up, coughing and sneezing, talking, shouting and singing, handling or laundering clothing and household linens, touching surfaces that are frequently touched by other people before eating or handling ready-to-eat food or eating food with your fingers, and domestic waste disposal. So we've looked at those as sort of collectively the 9 moments for targeted hygiene. And so what we're looking at is 2 things really: the surface disinfection at key moments, and hygiene at moments when it really counts. So this is thoughtful, risk-based approach when, where it matters, and the hand washing or hand sanitizing when basins are not available, when and where it matters. So there's a document here that I produced with Sally Bloomfield called Breaking the Chain of Infection, and this elaborates more on how people can identify with the different moments, and this is not for consumers, this is for people who work with consumers. So it's to give people ideas for how they can encourage good hygiene at these 9 moments. And we're currently engaged in we're just about to embark in some research to look at ways to change behaviour. What would be the most effective way to implement this, which should be very interesting. Right. So it's all about when, where and how. And this is just one of the moments. So it's looking at what we need to do when handling and preparing raw foods. Where basically could the germs go? What do we need to do about it? What are the actions that could be taken? So this is a freely accessible document that people can then take and use to give them an idea of how they could actually get these messages across. So it might be companies that want to sell cleaning equipment. It might be health professionals who want to train other health professionals to go into the home, for example, and train cleaners and staff who are caring for those who are vulnerable. It might be used for businesses even to try to, not this particular one maybe, but the idea is that it's a useful resource that can be used by many different people. So we've got another one on touching surfaces frequently touched by other people. And this summary table just sort of sums up what actions are needed at each of the key moments. So each of these key moments are dealt with separately, and then we've lumped them together in this document, which can be quite helpful in terms of what action can be taken, whether it's hand hygiene, which is all the way through, and then there are certain things where we might want to do other things, for example, air hygiene, social distancing, mask wearing, ventilation, and so on. So in relation to hand washing, then obviously we know that washing hands regularly with soap and water is one of the most simple, affordable and effective ways of preventing ill health and saving lives, because that's the mantra from WHO since 2013, and absolutely right. But of course, what I'm interested in is when people wash their hands as well. So we need to think about what is regularly, when should it be done, what happens if you can't wash your hands, and is a single message sufficient, or does it need some qualification? And then it becomes too complicated. So some of the examples I will show later on will show how we've tried to tackle some of that. The other thing to remember is that we need to get more hygienic when someone in the household is infected, or if they're very vulnerable, or if the household is very busy. So one of the most common sorts of questions I get when asked to go on the radio is, how often should I do X? And I always say, well, it depends. It depends if someone's infected in your household, or they're vulnerable, or how busy your household is. If you live on your own and no one touches your hand towel except yourself, then the amount of times you need to change it or wash it will be much less than if you have a very busy household or lots of guests. Sorry, cutting a bit. So let's just look at how this approach can be used for public settings. So this is for a couple of things that I've been involved with. The same principles apply, and we still need to think about the Swiss cheese model, but we're also thinking about behavioural theory, particularly in large events, to enhance public engagement, because it's very much a partnership between the facilities managers, the people involved in cleaning, and the public. So because the public are helping to move the germs around. So if we can't get them to wash their hands, then there's a key issue in breaking the journey of the germ. So this is also very much a risk-based approach. So we were lucky enough to get involved with two very large events in the UK, and we've also done Dubai Expo, which puts everything onto a different scale altogether. But COP26 was an extremely important event that was in jeopardy because of COVID-19. And so we worked very closely with the Cabinet Office to help support them in hygiene measures, and provided all the products that they needed. We provided hygiene kits for every delegate, which contained a face covering, some wipes and some sanitizer, and some hygiene tips as well. And also the Commonwealth Games, where we were the partner there for hygiene, and also Durex was involved as well. And we were then, for the Commonwealth Games, it was interesting because we could learn from our experiences at COP26 and try to had a little bit more time to think about behaviour change and what we could do about hand washing and how to improve public reception of hand washing, particularly as we were a bit further on into the pandemic and there was starting to be hygiene fatigue. So we used all the functions really that we could get our hands on, whether it was people who understood about disinfection, behaviour, hand hygiene, personal hygiene, and product development. And the approach for COP26 was pretty much done. It was done the same way for the Commonwealth Games. What we had to do was, it was so enormous, we had to group the locations into 12 types of location, And then we put together a risk assessment with a justification for 7 factors for every activity and surface in each location. So it's quite a lengthy process, rating high, medium and low, giving them a numerical assessment. And this process was reviewed and ratified by the London School of Hygiene and Tropical Medicine. And basically we use that to inform about the protocol and the frequency and timing of disinfection, so where and when it was needed based on the principles of targeted hygiene. And we did advise on other interventions as well, but that wasn't really our remit. And we organised bespoke training to be delivered by REHIS, which is the Environmental Health Institute in Scotland, and we also employed our own EHOs who completed compliance verification. We identified when critical times for hand washing or hand sanitizing would be, and made sure that we put in hand sanitizer stations at these places. And one of the things that we noticed that was very important is that quite often hand sanitizers are put on the wall. And in a large area like this, that's no good at all, because nobody is going to leave the queue to get into the conference to go and sanitize their hands. So the hand sanitizer stations were all freestanding, and they were put really in the way so that people, it was in their faces, they could see that there was a hand sanitizer there, and there's maybe a message on there as well to encourage people to use it. So we thought about the flow. How are people going to walk around? We walked the routes ourselves as well, and determined the high risk areas where we really did need to put the hand sanitizers. We had massive plans on our computers, and we plotted where the hand sanitizers were to be put. There were, I think, over 500 hand sanitizer units, like this one down here that was used. And we developed messaging and nudges to help people to take it up. We had hygiene kits, as I mentioned before, and for the Commonwealth Games, we also provided those as well. Where's my mouse gone? In terms of training, we liaised with with REHIS, as I said. The trainers carried out a bespoke version of an elementary cleaning and disinfection course that we tweaked to put in information about targeted hygiene and how they should use the products. We developed cascade materials, and the cleaning staff were also trained on using ATP machines to check cleaning standards had been achieved. We recruited these EHOs to also use the ATP machines to check through sampling and observations that the cleaning and disinfection was happening in the right way. And obviously they couldn't get around everywhere, but they did a representative sample. And we had Reckitt team also making observations. We had a cloud-based system using Hygiene Ensure, and that meant that I sat at home basically and could see the results coming in, and then if we had unsatisfactory results, then they went in, coached and then retested. So the idea here was to check immediately after the teams had carried out the disinfection to make sure that they reached the threshold that we decided would be acceptable, and we did that in conjunction with Hygiene. So 50,000 touch points, in the end 15 protocols and 30,000 hygiene kits, so rather a lot of stuff. Massive amounts of hand sanitizer, hand wash, and wipes, and antibacterial spray. The true clean ones were chosen because they were more natural and didn't contain chemicals which the COP26 would not like. So that was a really good step forward as well for using those types of products. The good news for us was, I mean, this was a bit of a headache, because you can imagine it could have all gone horribly wrong. We've got all these people stuffed into a smallish space, and sometimes in meeting rooms from all over the world. You know, we could have easily had an outbreak of COVID associated with COP26. It would have looked really bad for everybody. As it turned out, a number of people testing positive affiliated with COP was 2 in 1,000, whereas in the Scottish population at the time it was 11 in 1,000. So we could say that this was good. Now, it wasn't, of course, just because of surface disinfection and hand hygiene. There was a very strong elimination policy, because people were not allowed to go into the event if they test, unless they could show that they tested negative on a lateral flow test and they uploaded it. So that was really, really, I feel so grateful that the government decided to take that route. But I mean, this was part of it, because people could have still been, and obviously were still positive despite that. So just moving on quickly then to proving how hygiene works. This is really difficult, and many companies and researchers have scratched their heads over this. How can you ethically conduct a study that shows that hygiene works? You know, do you have to give some people no hygiene and watch how ill they become, and then put a hygiene intervention and then measure that exact same replicable cohort to see whether they're going to be ill? It's very difficult. Some people have tried this. It's taken many, many years, cost millions of pounds. So what we're moving into now is something called QMRA, and this is quantitative microbial risk assessment, which is really extremely exciting. This is, in a nutshell, a way to measure the risk of infection before and after an intervention using real-world data in modelling. And this is something that I'm very much involved with at the moment with the company. And we're working with the University of Arizona with Professor Kelly Reynolds, who is an expert on infectious diseases, but also on modelling. And she's done a number of different studies that are published. If you Google Kelly Reynolds, you'll find a lot of work that she's done. And the basics of this are that we use mathematical models, but we also use real life data that we put into this model. They run the model over many millions of times to replicate all the different variables that might occur, and they can come up with a risk of infection for different types of microorganisms in certain circumstances. So one of the things that we've done is use tracer organisms which react in the same way as a virus, but they're bacteriophages, so they're actually not dangerous to humans. So we can put those into an environment and see where they go. And that in itself is interesting. We've also done observational studies, so looking at what people touch and in what sequence and how they're connected with each other. And again, we're coming up for some publications probably in the next few months where we'll be able to share the results that we have found. And it's really, really interesting to see how people are connected through touch, where this tracer organism can go when you let it loose in a public space. And then look at what the result can be if you put an intervention in. So you take a tracer organism, you let it loose in a controlled situation, and then you put an intervention in and measure where the tracer organism has gone after that. So what's the what the model can come up with is basically the risk of infection. So it can show us what's the risk of infection before the intervention and what's the risk of infection if you carry out the intervention, the hygiene intervention. It might be washing your hands, it might be disinfecting a surface at certain places. Of course, we're particularly interested in trying to look at this in relation to targeted hygiene. And what was really fascinating, looking at just the initial results for the tracer organism, was that we found that where people had applied targeted hygiene, then there was a reduced amount of exposure to the tracer, even in areas that hadn't been cleaned. So in other words, it stopped this journey of the germ, which was very exciting, and sort of shows that you don't have to clean and disinfect everything, but if you clean and disinfect the key areas at the key moments, then that will be sufficient. So basically then we're giving people the information about the risk of getting ill from an infectious disease compared if you don't practice hygiene with if you do, if you wash your hands at a key moment or disinfect a surface at a key moment or key moments. So we're just about to launch some more studies in this area, and I think this is definitely a way forward for organisations, for governments. The CDC in America are very interested in it, and they're carrying out their own research, as I'm sure you are. But it is an exciting area of science. So in terms of what the IFH and the RSPH are saying, what we feel we need is to make sure that we look at hygiene in a more holistic way. At the moment, it's in lots of different silos, and they're not necessarily talking to each other or joined up. So we've got the UK HSA, we've got the FSA, we've got all sorts of people in different places, and this is another thing that these requests really went in through the all-party parliamentary group as well, to try to tie up hygiene across government departments so that the messages to the public are coherent and consistent. Because often you can find something on an NHS website that is in conflict to what might be on somebody else's website. And it's really making sure that people get those messages, the key messages, which is about when and where to take these actions. How can we actually get people to understand about the chain of infection so that they've got the tools to break the chain of infection when it needs to happen, rather than being very prescriptive, but we actually help people to make those risk-based decisions themselves. So there's a couple of publications which Sally and I have just brought out. One's in Public Health in Practice, and the other is in Perspectives in Public Health. I'll just see if I've got them there. And there's also a document with the RSPH as well, which is about practicing good hygiene at home. So that's the Public Health in Practice one. And then we've got the, this is only just being published. So this is one in Perspectives in Public Health. So that brings me to the end of the presentation. So thank you very much. We've still got about a quarter of an hour left, 10 minutes or so for some questions if anyone has any. Thank you.
Thanks very much. Lisa, I just had a quick question, well, more of a housekeeping. Would it be possible if you could share your slides, your PowerPoint presentation slides, and we can circulate them with the audience? Because I know there's some links, to some articles, and I know that handbook of 9 things you can avoid, or 9 tips, was really useful. So it'd be good to see that in more detail.
Certainly. I might have to remove a couple of things, but yeah, I'm sure
of course,
that'll be absolutely fine. Yeah.
Thanks so much. Is there any other questions? I know we have 10 minutes left. If anyone would like to put anything in the chat. Lisa. Wanted a bit for those to trickle on in. It was really interesting to hear about your experience of the COP event. I'm sure tensions were running high.
It was, yeah, it was quite scary, really, when I got taken on primarily to help with that in June 2021. I was thinking, oh my goodness, we've only got 5 months before the event, and there was so much to do and so many people involved. You had security as well. I mean, we couldn't even see where some of the locations because they hadn't been built or we weren't allowed in them. So it was very, very difficult, but you just pull out all the stops, really. So it was a relief when it was over and there wasn't a major outbreak. I can tell you that.
I've just received a question here. It has a pop up in the chat about question about behaviour change. What approaches / models do you use, and how do you know if they've worked?
Right. Well, unfortunately, at the Commonwealth Games, we wanted to try. We'd been looking at POM-B and also the health belief model, which is something that I did for my PhD. So we'd looked at the two things together, and we took advice from behaviour change people at the London School of Hygiene and Tropical Medicine. And we came up with concepts for how we could actually encourage or nudge people into hand washing. And we had a sort of list from them of the various things that we could try. And what we really wanted to do was to set up an experiment where we had one type of hand sanitizer unit in one place and another one in an identical place. So, for example, at the bottom of a flight of stairs to an arena. Because we had developed some hand sanitizer units that actually spoke to the recipients and said, thank you very much for washing your hands, and they had a counter on them so that we could encourage people through thinking, well, other people have done this. Well, one of the important ways of encouraging people is the sort of herd feeling that they're all contributing together. Unfortunately, we just couldn't get access to put our 100 units in. They did go in, but we couldn't get access to actually set the experiment up. So we don't actually know whether or not it worked. What we are going to do is we're going to set this up in some office environments so that we can start to do more of a study. The other thing that we did have was we used stickers in, well, they weren't quite stickers, they were sort of electrostatic stickers, and we put those on the back of every single toilet door, because some of the research that we looked at showed that when people come out of the toilet, there was some studies using line of sight, and they actually didn't look at the basins. If they weren't going to wash their hands, they just walked straight out. So we thought the typical place where you put a notice to wash your hands is above the basin. But of course, if someone's already not going to go near the basin, then that's useless. So the people we wanted to catch were the people who probably weren't going to wash their hands. So we used stickers and we designed them. We worked with a design team to make them into really engaging messages on hands, for example, and they were all to do with the Commonwealth Games. So, medal winners clean their hands, this sort of thing. And we put those on the back of every single toilet door. And again, it just wasn't the environment where we could set up an experiment to see how well the uptake was. But on the first night, it was almost unheard of that they ran out of soap in the men's toilets, and it had to all be brought in. And now, really that had never happened before, I don't think. So that's the only circumstantial evidence we have. And it was a real shame that we couldn't utilise that situation to actually do some really good observational and measure. We could measure, the soap use and the hand sanitizer use against the number of people going in, but it just wasn't feasible at those events because of difficulties getting access at different times.
Good, thanks so much. And we have a similar-ish question. Can you think of any behavioural suggestions or nudges that could be encouraged for food business operators in terms of hygiene and hand washing, rather than the customers themselves?
Yeah, well, I mean, going back to the stickers on the back of the loo doors, I'm so old that I was around when the legislation actually required a sticker on the back of the toilet door in all food premises to say wash your hands, and that sort of got lost. And I just really think it's that encouragement at the point when people have just finished on the loo. So whether it's by the urinal, whether it's behind the cubicle door, get some messaging out there for the staff and the customers to encourage them. The other thing we noticed was that people like the soap. If they like the soap and they like the hand sanitizer, then I think that's going to make a lot of difference. So I think businesses need to think about that as well. If it's a product that's very harsh, people are going to avoid it. And certainly when people washing their hands too much, that was an issue. So I think you can engage the staff to get them to perhaps test products with you to make sure that they like them, and then they're more likely to use them. But it's that sort of messaging. It could be audible messaging when people go past a sanitizer. It could be thank you for using it, even before they have. Those types of things we were looking at and are still looking at, because we work very closely with many businesses, including British Airways, for example, Hilton Hotels, and obviously those organisations, particularly in the early days of getting back into work, going back to flying, were very keen to contain COVID as much as possible, and we're very receptive to using whatever nudges we could come up with. I mean, other things are that you try to make it surprising. So you might put a bunch of flowers on top of a sanitizer station, for example. That's one of the things the behaviourists came up with. We're working, the IFH working with the behavioural insight team, and I've got a meeting with them this afternoon where we're actually going to talk about how we can test behaviour change methods to do with the 9 moments of hygiene. So Sally Bloomfield and I have got this meeting, and we're hoping to engage them to carry out some research for us, to come up with some useful tips for everybody really who's interested in hand hygiene and surface disinfection, to understand what's the best way to try to change behaviour. But I think it has to be surprising, engaging, encouraging people to do what everyone else is doing. There's been many studies where if someone in front of you does something, you'll follow, that type of thing. So there's not one fix, but there are lots of useful ways that we can try to improve engagement.
Okay, and on the topic again of signs, question come in: signs directing food handling employees to wash their hands are a legal requirement in other regulatory systems. Do you think that would be beneficial here?
I do think it. I think it would, because often businesses want to put all sorts of other stuff on the back of toilet doors, like Christmas offers and all the rest of it. But actually, I think we've got to make a collective concerted effort to get people to wash their hands. This is one of the most important things that we can do to help prevent risk of infection. And many researchers are spending a lot of time in low-income countries engaged in trying to improve hand hygiene, because they know how much that's going to save lives. But even in this country, there is plenty of opportunity to reduce risks of infection if we can only get people to wash their hands. So I think, yes, we should enforce it. People will resist it otherwise, and certainly it used to be there.
Get people to revert back to old ways.
Well, that's right. I mean, my granny used to tell me about how the teacher used to inspect their hands and sort of smell to see whether they'd used soap before they were allowed into the classroom. And, because in those days they didn't have antibiotics. And of course, we are getting to a point where we may not have antibiotics too. So preventing infection is really important. And I think particularly young people are so used to having a fix for any medical ailment. It's going to be a real shock when they realise that there isn't a magic pill, and actually basic hygiene will help them so much to reduce their risk of infection. I mean, people think I'm a right old bore about hygiene, but really it's so simple, and we just need everybody to do it.
Great. I'll just take one more question. I'm conscious we're just at the 1 o'clock mark, so it's the final question. But I've heard people say it is good to expose young children, infants, to small animals such as puppies, as it builds their immune system due to some of the things that they secrete. Do you know anything about this, and if it's safe or true?
I think you just have to remember that animals can have huge benefits. They can excrete pathogens too, so it's just a matter of being cautious. I've got a dog. I don't mind. I don't worry about the hygiene of that, but when I'm picking up poo, I'm careful. I wash my hands and so on. So it's just exercising caution when there might be a risk of pathogen transmission, which is when they've had an accident, particularly say in the house. But the studies from the likes of Graham Rook have shown that exposure to what he's calling these old friends, and we need to try and find a better word for it, but the microorganisms that are not dangerous and may actually be beneficial is very important. And he's particularly keen on people going out into the fresh air, into woods and natural environment where they can pick up and actually breathe in some of the microorganisms that we may no longer be exposed to if we just live indoors and in an urban environment.
That's great, thanks so much. So in which case we will bring the session to a close, and thanks so much again to Dr. Lisa Ackerley and for the presentation, and everyone for their questions, and we will circulate a recording in due course and see you at the next Food for Thought seminar. Thanks so much, everyone. Have a good day.
Thank you. Thanks very much.